Ms. Irene Quay.
Mr. Deputy Speaker, sir, thank you for the opportunity to speak on the Infectious Disease Bill Amendment. First of all, I would like to declare my interest as the President of the Pharmaceutical Society of Singapore. I understand that the recent amended bill has been focused on strengthening contact tracing, surveillance, communication and disclosure of information for infectious disease. However, it is to my surprise that there's not much mention regarding the legalization to curb global and national issue of antibiotic resistance. To provide some information background, antibiotic and antimicrobial resistance occurs when microbial or microorganisms such as bacteria, virus, fungi and parasites change in ways that render the medication used to cure the infection they cause ineffective. When the microorganisms become resistant to most of the antimicrobials, they are often referred to as superbugs. This resistance occurs naturally, but it is facilitated by the inappropriate use of medicine, for example, using antibiotics for viral infections such as cold and flu, sharing antibiotics, or excessive inappropriate use of antibiotics in animals. I shall henceforth refer to antimicrobial resistance as AMR. On the 30th March 2017, a new Bill 1840 was brought before U.S. Congress to provide tax incentive to reinvigorate antibiotic research due to the grave nature of AMR. The growing resistance of human infection to antimicrobial agents has emerged as one of the most pressing health problems in Singapore and the world. I understand that the National Research Foundation announced the launch of the new Antimicrobial Resistant Interdisciplinary Research Group in January 2018 in conjunction with the Singapore National Strategic Plan for Antimicrobial Resistance, hopefully to better understand how microbial resistance happens and to develop new antibiotics to curb these superbugs. A study from the Singapore MIT Alliance for Research and Technology shows that AMR currently results in about 700,000 deaths per year worldwide, with recent studies predicting an increase to 10 million deaths per year by 2050, outpacing the mortality of cancer. The economic burden will follow a similar trend as a result. In the United States alone, AMR bacteria infected 2 million people every year at a healthcare cost of 27 billion Singapore dollars. On a global scale, AMR is predicted to cost up to 130 trillion Singapore dollars by 2050. These statistics are very distressing and not at all encouraging. According to the World Health Organization report, only 11 antibiotics in clinical development could address pathogens considered critical threats, and 3 in 4 of the antibiotics currently under development belong to existing class of antibiotics against which microbial resistance has already been observed and could easily develop due to the innovative nature of this superbug in invading our current controls. So at this rate, the world, including Singapore, will run out of antibiotics before long. And we might possibly go back to the era where even simple skin infection or urinary tract infection could kill us. The severity of this threat should not be underestimated, and I urge that we deal with this issue critically and swiftly. Tackling the AMR problem will require a multi-pronged and multifaceted approach. I acknowledge with relief that MOH has set up the National Strategic Action Plan on Antimicrobial Resistance, engaging various ministries, AVA, NEA, PUB, etc., to evaluate various core strategies from public and healthcare professional education, surveillance and research and risk assessment, research, prevention and control of infection to the optimization of antimicrobial use. And I applaud MOH for their tremendous effort in tackling this pressing threat. While a lot of surveillance and engagement work has been focused on hospitals since 2009, much more salient efforts has to be applied to get to the root of the problem. This includes how can we further enhance our AMR surveillance to grasp the utilization rate of diagnostic toolkits which can be used to differentiate viral and bacterial infections, as well as where and how much antibiotics are being sold, prescribed, and dispensed in each hospital, GP clinic, retail pharmacy, and for animal use. It is then necessary to extract such detailed information and apply data analysis or audits to identify specific abusive users and establish a feedback mechanism for better accountability. As such, I would like to propose measures that are imperative in resolving and lessening the impact of AMR in Singapore. Currently, we have systems in public hospital to curb the misuse and overuse of antibiotics, but we will require a similar framework in a community where 80% of the primary health care is provided by private practices. I would therefore like to advocate an AMR task force to discuss and recommend strategies to ensure appropriate use of antibiotics in the community setting, such as reviewing and streamlining of an antibiotic formulary available for perusal within the community, and exploring prescribing dispensing separation where possible. It is also essential to urgently come up with clinical practice guidelines on the use of antibiotics, the appropriate course duration of use, as well as conduct audits on the appropriateness of antibiotic utilization, especially for broad-spectrum antibiotics like quinolones in the community setting. Educational programs for healthcare providers in the UK have shown considerable effectiveness in reducing the prescription of antibiotics in primary care, and maybe similar programs should be enacted in Singapore. Flu vaccinations are currently claimable by Medisave for specific population groups. This coverage should be extended nationwide and offered at a subsidized rate to our pioneer generation under the Community Health Assist Program. Flu vaccination should also be introduced into the National Childhood Immunization Program to ensure that school children benefit from this, at the same time increase the overall national take-up rate. A 2017 systematic review published in the Journal of Epidemiology and Community Health looked at studies that calculate the return on investment for public health interventions. The researchers identified 52 studies that look at interventions at local and national levels. Health prevention interventions, which would include vaccination that match the actual influenza type, have saved $34 for every $1 spent on them, according to the review. Such a high return occurs because of all the disease and death prevented. In light of this review, a national public awareness program should be incepted to educate the general public on the potential side effects and infections from the uninformed use of antibiotics. Citizens should be warned to refrain from asking for antibiotic prescription from their doctors. I understand the Health Promotion Board is already working on this, but more aggressive and intense public education campaign must be carried out to raise urgent attention. Clostridium difficile, a bacterium which infects the bowels and causes diarrhea, is one such example of an infection usually related to antibiotic use, particularly in hospitals. It has been responsible for an estimated 14,000 deaths annually in the United States. Other potential deadly side effects due to drug allergy include anaphylaxis, a life-threatening allergic reaction, or fatal skin reactions like Stevens-Johnson syndrome and toxic epidermal necrolysis, fungal infections which lead to severe itch from vaginal yeast infection, or burning mouth sores from oral thrush, and antibiotic-associated diarrhea. There is a compelling need to empower patients to speak up and discuss risk versus benefit of imbibing antibiotic with their doctors to help them take ownership of their own health. Emphasis on the importance of hand hygiene and infection prevention measures in the community should not be understated. Similarly, the importance of flu vaccination and the fact that getting vaccinated protect loved ones around you, such as those that are more vulnerable to serious flu illness, like babies and young children, as well as older people and people with certain chronic health conditions. This is possible through the vaccine herd effect or herd immunity, which makes a disease hard to spread because there are very few people who are susceptible. To facilitate these actions, the use of rapid diagnostic health devices should be promoted and distributed widely at a highly subsidized rate. This will make it more cost-effective to use these devices compared to paying for a course of antibiotics. AMR is a major worldwide complication that has persisted and will continue to persist. It is something we simply cannot afford to disregard in the slightest, if not to invite disastrous consequences. It requires the synergistic coordination and collaboration of everyone in Singapore to combat and safeguard against. The cooperation of citizens, operators, healthcare professionals, diagnostic and pharmaceutical industries, educators, researchers, various government ministries and policy makers should be sought out in order to fend off this dire situation. Globally, many countries struggle with this deplorable predicament. I firmly believe that Singapore, being a country of first world infrastructure and data management, armed with capability of a smart nation, can and should employ data analysis and a pool of highly educated citizens to weather this storm. I'm certain that we can proclaim to the world that it is indeed possible to come out on top and reign in AMR. Notwithstanding my proposal and concerns above, I stand to support the bill amendment. Thank you.